I just want to kind of be one of these voices to kind of normalize this and be out there telling people like, if you got something going on and you're trying other things, keep trying other things. Obviously, for me and a lot of my friends in and outside of dentistry, EMDR has been a great one. So maybe try that track to start out. But just keep plugging away, keep taking one step, put one foot in front of the other, because I lived for quite a long time with a sense of hopelessness, and I now live with a lot of hope, and that's an exciting message, I think.
This is Growth in Dentistry, a dental intelligence podcast, where we ask the question, what does growth in dentistry mean to you? I'm Steve Jensen, a dated dental nerd and your host.
Welcome, everyone, to another episode of the Growth in Dentistry podcast. I am super excited for our guest today. We are going to take a little bit of a different spin. I think folks are used to me diving into like the nitty gritty of the highest performing practices. Today, for context, is another one of our deep dive episodes where we're going to actually talk with a doctor about like his story and life and how he's ended up in the place he's in today. But we're going to take a little bit of a different spin, really setting up the foundation for how do we create kind of like a mentality that leads us into success, I think. So before I jump in and introduce our guest, Dr. Danny Snyder, I want to give a huge shout out to the marketing team at Dental Intelligence. Producing this week after week is a huge effort, and I'm so grateful for them and for Dental Intelligence for investing in this podcast to get content out there to the industry. So as always, they have a $50 gift certificate for anyone that'll come and do a demo of the software. If you haven't checked it out for a while, there's new things that are always coming out. In fact, I'm excited about a couple things that are coming out right now. So we just released like a referral scorecard. So it allows you to track like where marketing dollars are actually yielding with like patient outcomes. So you can track like, okay, I'm spending dollars on my paid ads, or I'm spending dollars on these mailers, and it'll actually help you track it down to like which providers are actually seeing those patients, and are they saying yes to treatment, and what specific treatment. So we've got some cool things there, some insights that have maybe been difficult to find before, and many other things. So if it's been a while since you've checked it out, definitely check it out. Now, without any further ado, I want to introduce Dr. Danny Snyder. So Dr. Danny is a local Utah guy, which I love. He grew up here in Alpine, Utah, which is close to Dental Intelligence headquarters, but went to BYU, which if you're following college football, I hope by the time we release this, it's still exciting, but BYU football is 6-0. They are just crushing it, which is really fun. So congrats, Danny, on your alma mater's football success. I'm assuming.
Yeah, my voice is a little bit gone because I actually flew down with my daughter to go to the game on Saturday.
No
So
way.
it was awesome. We loved it.
So he did his undergrad at BYU and then went to dental school at University of Louisville, and then has ended up now in Washington. And I'm gonna like let you take over. I want folks to kind of hear your background. So where did you go after dental school? Did you start as an associate, practice ownership, and kind of walk us through your career? Because I think it's fascinating. I think your story's really cool, and there's lots that we can learn from you. So I'm gonna like shut my mouth and I'll ask questions as we go.
Awesome. Well, really appreciate you having me on. One of the things that I'm really trying to do at this point in my career is share my story, because I think my career path has been very different than what I had hoped for when I was at BYU. And in a lot of ways, it's significantly better than what my dream practice was. And also just thankful for Dental Intel, because they've been with me through this journey and really helped me to be a much better dentist and serve my patients a lot better. So when I was at BYU, on paper, dentistry was the perfect career for me. I'm a lifelong woodworker, artist. My mom is actually a professional calligrapher, so she taught me how to do calligraphy and art and all this different stuff. So I've always loved working with my hands, but I also wanted to be in the dental or in the medical field. And then at the time, I was really into the idea of owning my own practice, being my own boss. And so again, dentistry just looked perfect. And then as I started taking all these pre-dental classes at BYU and also the first 2 years of dental school, everything I did reinforced that idea, because I was, waxing teeth, drilling and filling on mannequin teeth, making little crowns, all this different stuff. And those hand skills that I've developed throughout my life just made this part of it so easy, so fulfilling, so enjoying. And so the one of the interesting things when I was in dental school that really caused things to kind of tip in one way or the other was when I first started seeing patients third year of dental school. And I remember actually the very first patient that I saw, I was sitting over him doing my exam. He was a Hispanic guy from Cuba. I speak Spanish. And I remember just having this like pall come over me, this gray cloud of just like, what have I done? Like this, something about this just really doesn't feel right. And so for about the next month and a half, I just remember having this kind of deep depression, almost like I'm already a couple $100,000 into this education, 6 years between BYU and here. And I I don't know if this is what I actually want to do with my life. And so
And that's
it
tough
was
because there's
just
no take backs. There's not like a,
exactly,
hey, if you end up not wanting to do this, we'll just, forgive the loans and you're cool. Like that's regardless of what you do, that you're stuck with that. Yeah, that's tough.
exactly. Yeah. And
Tough.
and that even added to that anxiety, that depression of just like, you know, I feel stuck. I really don't feel like I have any other option but to keep going deeper down into this hole that's like, really, really scaring me, really causing me issues. And so over time started to get a little bit easier. You kind of get over the first few times when you're giving people anesthetic and you're afraid because you're causing them pain and they're flinching and you're like, there's that kind of apprehension. And over time it tends to get a little bit better. And so then, right out of school, I went to Houston, Texas for 2 years. My wife had a sister down there. I had a really good job opportunity. It was a large practice. They used dental intel. And we had 16 chairs, 5 doctors, usually 3 or 4 of us were there
Yeah,
each
big
day.
practice.
Yeah.
Yeah.
And it was a great place to kind of build up my speed. My boss was fantastic. He was also very understanding of these anxiety issues that I was having and kind of guided me through and had some of those issues himself. And so over time, again, it got a little bit easier, but I feel like it was at least every other week that I would send my wife a text in the middle of the day and be like, I need you to say a prayer for me. Like I can't get through this day. And so after about 2 years of that, we were like, okay, I think I'm ready. I want to own my own practice. That was always the dream. And
So
so
at
we were
that
like,
point, had you kind of like alleviated some of those stressors? You're like, okay, like I can do this. I can do the dentistry. I'm 2 years in. Like, were you feeling, I'm assuming if you're making the jump to like decide you're gonna buy a business, or did you want to buy the business because you're hoping like maybe I'll hire associates and not have to do the dentistry and I'll manage? Like, what was in your mind making that shift?
yeah, in certain ways it had gotten better. In other ways, I think I had just kind of buried it deeper and deeper.
Okay,
But a
classic.
big part of, wanting to own my own practice was that in that large practice, I oftentimes would feel, and it may have come from within, or I don't know exactly what they had maybe communicated, but certain procedures I just really didn't enjoy. And so I was like, okay, if I'm the boss, I can do the procedures I like, I can refer out the stuff I don't like, and then
Mhm.
just be in a little bit more control of that. And so my wife and I were like, okay, well, if we're buying a practice, we're pretty much putting down permanent roots. Where do we want to be? And so Houston wasn't what we loved. 2 Houston summers were plenty for a lifetime. So we actually landed on Spokane. We have some family here. My wife's parents have a lake place in Montana that's just kind of at an arm's reach. And then my best friend from junior high and high school is up here. So anyways, that has been a fantastic choice. We love Spokane. It really is a great place to raise a family. And so then when I got up here, it actually did get significantly better. I bought a hygiene practice that the dentist who was retiring worked till he was 71. But it was patients that were relatively high dental IQ, right? So they're taking very good care of their teeth. When they need something done, it's one filling, one crown. Did a fair amount of cosmetic stuff, which I've always really enjoyed. But my team was fantastic. We inherited a team, kept about half of them. Half of them decided to move on or just weren't, a good fit. And so that steadily did get better over time, and we built this team. And so we moved here in 2017, and really just kind of the apex of the practice, like if you were to pull up the dental intel numbers, was the beginning of 2020. And so I, again, just had the perfect staff. Everyone knew where they were supposed to be, took responsibility for their stuff, came early, stayed till the work was done, helped each other. It was just, we had this perfect mix. And then this is kind of a random aside, but I don't know if you've heard of the company Clean Simple Eats in Utah. They make
Yeah,
like the
I
protein
have.
powders and stuff like
Yeah,
that.
I've had their protein
So
powders. My wife's all about it.
totally, right? So anyways, beginning of 2020, I decided, I was like, I'm gonna do their quarterly challenge, like their weight loss challenge. And so I like went all in on it, and I was working out every day, and I was eating right and all this stuff. And I actually won the competition
Way
at the very
nice.
beginning of March. So my wife and I won a trip to Florida,
Uh-huh.
and yeah, so the practice was doing great. I was healthy. My mind was a lot healthier than it had ever been. Um, and then, like 9 days later, the world shuts down, right? And so at this point, and we can kind of interject this a little bit, for the year prior to the pandemic, I had been developing a product called the Slate Electric Flosser. And
Mhm.
so the very last week of February of 2020 is when we sent our life savings to a group of engineers in Draper, Utah, to help us start developing the product. And so when the world shuts down, my practice is closed, we're making no money. My wife is like, call them back, get our money back. We have no
Oh
money.
no.
But in a way, that kind of ended up being a little bit of a blessing, because for those 2 months that my office was shut down, I could work 100% on the flosser and with the engineers, and could in real time send stuff back and forth. So that was actually kind of a good thing. But anyways, coming back from the pandemic was really when things started to take a really turn for the worse for me. Part of it was just that trained dental staff all over the country, but especially in Spokane, were not coming back to work. And so since there were fewer and fewer of them, the community clinics, other large group practices in town were offering hygienists and assistants just insane amounts of money to be able to, keep their practices up and running. And so all my staff came to me, and they were, hoping for big raises, or else, deciding to
Yeah.
take off. So I, had to kind of pony up and start paying them a little bit more. Caps, gowns, gloves, mask, everything price just goes way up. And again, like I said, in this kind of hygiene practice where we're not so much depending on a huge onslaught of new patients. We had a healthy amount, but
Mhm.
that scale that was kind of perfectly in line right before the pandemic just tipped. And it was like, I'm taking home way less money. Fewer patients are coming in, fewer doing elective treatments, and so it just really started to become quite stressful. So, but we started to, we kept plugging along with Slate. And then in October of 2021 was really when the hit the fan, right?
Yeah.
And, one thing that happened was my landlord, who owned my dental practice, or the building I was in, he sold the practice to a large dental group. And so that was kind of one thing, and I'll kind of round that out in a second. But the other was a few of my staff decided to quit and take off. And then, Slate, we did our Kickstarter in October of 2021, and we hit $200,000, which was incredible, right? That's
Awesome.
an outcome that you just would
Yeah.
dream of, right? But it was kind of all these other stressors. Even though that was maybe something a little small, it's like, oh crap, I now have to execute, and I have to fulfill all these orders and do all this stuff. And it just kind of became too much. And then going back to the building sale, um, there was some paperwork that I signed that I didn't fully understand what I was signing, and was a little bit shady, I guess you could say. And
Mhm.
anyways, they I I was losing my ability to renew my lease. I was about 4.5 years into a 5-year lease. And in my initial lease, I had an option to renew for another 5 years. And some paperwork that I signed without fully understanding what was going on took that away. And so I had 6 months to either find a new place. And I talked to my Shine rep, I talked to everybody, and like it's going to be about $300,000 to $500,000 to build out a new space, and that's a total sunk cost for me, you know. And I had just spent
You had just spent all that money
$150,000.
on Slate.
Yeah, and well, and I'd spent $150,000 to renovate my dental practice, like the space as well.
Oh,
And so I was losing that anyways. So in the end, the dental group that bought my practice, or that bought the building, offered to buy my practice. And in a lot of ways, I kind of felt backed into a wall, didn't have any
yeah,
other
like
really
too much
good
option.
option, you know. And so that's what we did. And
And did you
luckily
have
we
a
were
contract? Did you have to stay on for a certain number of months?
so it was a year, and then also some things to do with non-competes and different things like that. But as I started to work with them, it was clear to both of us that this wasn't going to work, you know. And so we both kind of came to the conclusion that it would kind of be best if I moved on. And so that's really where kind of my mental health hit its lowest point. And me and my wife kind of discussed things, and it's like I had been working with therapists, trying all these different medications, really trying to do everything I could. And and so actually in October of 2022, I went to a couple of facilities actually. So one here in town that just after a couple of days, like, hey, this isn't the spot. And then after that, went over to Seattle, to this place that I was there for about a month. And I've talked to several friends, and they're like, well, what did you think you were going to accomplish going to these mental health treatment facilities and things like that? And it was really just kind of this desperation of like, I've seen so many therapists, I've tried so many things. I need to go somewhere else in hope that someone will hear my story and be like, oh, you didn't try that. You needed to try that. That's the thing
Mhm.
that's going to help tip the scales for you. And so when I was there in Seattle, we do all these group classes, but we also had kind of a personal therapist that we would meet with every other day. And this guy named Matt, just he was that guy. He saw the thing, you know. And so what he pointed out, or at least asked me, he was like, have you ever, with any of your previous therapists, talked through your childhood dental trauma? And I was like, no. And I didn't, and it's hindsight's 2020, right? And you look back on it and you're like, okay, I didn't necessarily consider it a trauma. I didn't like going to the dentist as a kid. And I was one of those kids that was walking around with a bunch of those silver caps on my teeth because
Yeah.
like it was just something that my dental offices came in twos as a kid. It was like the exam, and a week later you go get fillings or caps or
Yeah.
whatever, right? And so that was kind of right at the tail end of my time there. And he was like, when you get back to Spokane, I need you to look up and ask for recommendations for a good EMDR specialist. And so EMDR is a form of therapy. It's called eye movement desensitization and reprogramming. And it can be done several different ways. The therapist can kind of move something side to side and you track it with your eyes. My therapist put these little buzzers in my hand and they would buzz back and forth. But essentially, when you boil it down to it, it's essentially trying to activate both sides of your brain and allowing you to go back to a certain time in your life where you've had a tough time or a trauma or something like that, and allowing your fully formed adult brain to go back and patch all these things that your
Mhm.
7, 8, 9, 12, 20-year-old brain just wasn't able to handle. And so for me, there was this one particularly traumatic thing that I had gotten a Jolly Rancher stuck to one of those silver caps, and when I tried to get it out of my mouth, it stayed stuck to it. And I think I was probably 7 or 8 years old. And so as she's turning these buzzers on, she's just having me think in my mind over and over and over through this experience. And after about 5 or 6 treatments of this, um, I was in my dental office, and I was kind of had that quintessential terrible patient, right?
Mhm.
Um, she was complaining about the cost. She flinched every time I touched her. She like the anesthetic hurt, everything hurt. The cold air, she was just the worst. And so I go back to my office, my personal office, after going through this whole appointment with her, and I sit down and I was like, something is different. Like that cold sweats, heart racing, mind going through like, why am I doing this? I hate this. I don't want to be here.
Mm-hmm.
It was nothing. And I was like, wait, what? And so then next day, same exact thing. And I went back to my EMDR therapist a few days later and I just kind of slammed my hands on her table. I was like, what did you do to me? It was like, and it literally was just this miracle drug, right? And it was something where, it really, as I look back on it now, it kind of makes perfect sense that, every day going in and experiencing the anxiety of my patients, and just wearing that on my sleeves, and that would have been something that just would have been triggering every day, and the good days, the days where I would show up and I'm doing cosmetic stuff or other things like that, you know, those had such large blocks of time um isolated to be able to focus on that one thing. And it's like, okay, that was a good day. And it's like,
Mm-hmm.
okay, I didn't experience one of those anxious patients today and things like that. And so in the end, I now work 4, sometimes 5 days a week, and I love being an employee dentist. And so it's one of those things I um, that I love about dentistry actually is that it gives you the ability to find your niche, find what works for you, what space works for you, doing the procedures you like to do. But the interesting thing too is that as I continue to share my story more and more, I hear more and more from either close friends, colleagues, people who hear me on a podcast and email me and things like that. And it's something that's much more common that I think we're willing to admit to. Dr. Brett Kessler, who is the incoming president of the American Dental Association, he's practiced in Colorado his whole career. He tells his story about how his anxiety got to the point where he started doing drugs, alcohol, cocaine, things like that. And so I'm hoping that his presidency will be something that will start to bring these things to light. And I just want to kind of be one of these voices to kind of normalize this and be out there telling people like, if you got something going on and you're trying other things, keep trying other things. Obviously, for me and a lot of my friends in and outside of dentistry, EMDR has been a great one. So maybe try that track to start out. But just keep plugging away, keep taking one step, put one foot in front of the other, because I lived for quite a long time with a sense of hopelessness, and I now live with a lot of hope, and that's an exciting message, I think.
Yeah, I agree. It's an exciting message. I think it's helpful just to hear like, hey, on the other side of hard years, what's there isn't always more hard years and scary. Like there are certainly like, ebbs and flows in life. Like as you were talking, I couldn't help like I was listening to this Chris Williamson podcast a couple weeks ago. And I've heard this Chinese proverb multiple times, but it made me think of this Chinese proverb where the story goes that there's this old farmer and his horse runs away, and everyone in the town is like, oh, what terrible luck. And then the farmer says, maybe so, maybe not, we'll see. And you probably heard this before.
Yeah.
Horse ends up coming back weeks later, and 2 wild horses come with it. And then all the neighbors are like, oh, what amazing luck you have. And he's like, maybe so, maybe not, we'll see. And then his son is trying to break one of the horses so they can actually like ride it and use the horse. The horse bucks him, kid breaks his leg, and everyone in the town, oh, what horrible luck you have. And he says, well, maybe so, maybe not, we'll see. And then the proverb ends with, the government recruiting for war, and they come through, and his son would have had to go to war, doesn't have to go to war, and everyone in the town says, oh, what great luck you have since your son doesn't have to go to war. He broke his leg. And he says, maybe so, maybe not, we'll see. Kind of this perspective that so many of these things in our life that sometimes seem great can end up being like downfalls. And sometimes the things that seem like there are downfalls end up being great. Like it was so cool to listen to your story. Like, hey, I want to go and own my own practice. You went and bought your own practice, which in a way, I think was a benefit. Like I think through your associateship in the practice, you're like able to save some money to invest in this electric flosser, like this passion project that you and your wife have that's still, I hope you give like a little update that's going, I think, well today.
Yeah. Yeah.
That's like a huge blessing. But like there was a moment when you were like, crap, like if we would have had that money, we could have like saved this business that you ended up selling. And I just think it's so interesting just to like take a deep breath and realize, hey, like time, I know there's a corny phrase, time heals all wounds and stuff like that, but like there's so much truth to a lot of those things. I
Yeah.
remind myself that like I'm not a dentist, but I'm involved in this startup, and I guess we're not a startup anymore. We're big now, but in the early days, like there are multiple times where I'm listening to you talk about going home and crying to your wife. Like I would go home and cry to my wife and be like, what am I doing? Like, do I really want to do this? And you take a breath and you get, years down the road and you're like, oh, okay, like this is what it looks like on the other side of that. And there's growing to be had and learning to be had. But I'm a huge advocate for mental health. So I'm going to like shut my mouth for a second because
Yeah.
there was a time in my life where I would wake up with a pit in my stomach every single day.
Yeah.
And it's just simply not like a super fun way to live. And I had this goal where I was like, I want to wake up in the morning and not feel just sick. And
Yeah.
therapy played a huge role in my ability to get to the point where like I can wake up and be like, man, like I am like, I don't know, like I just take big breaths. Like I'm genuinely grateful for today. Like it's a cool world we live in with great people and there's lots to be, enjoyed. And anyway, so I'm interested to hear like
Yeah.
what other advice would you give to dentists out there that are listening that may feel that same thing? Maybe it's a pit in their stomach every morning, or maybe it's they end their day and they just like aren't sure they want to do it anymore, or whatever kind of they're feeling, or maybe they're in the thick of it, and they are doing some of the things you mentioned that Dr. Kessler was doing. Like, what would your advice
Yeah.
be to them?
Yeah, for sure. And, your whole pit in the stomach thing, one
Mhm.
of the things that I share with people is that for the first 8 years of my career, if I went on vacation, it would take me literally 2 to 3 days to like ramp down after the previous week's work. And then
Totally.
I'd have maybe 1 or 2 days, and then I'd start dreading going back. And so it's like my vacations were like one day right in the middle. Um, but yeah, no, I 100% that time, the perspective that time gives you is insane. Like I think back on that piece of paper that my landlord had me sign, which essentially sealed my fate and almost stole my practice from me, right? Just that one thing. And for years, I was like, it's like, why? Why did I just sign that? Why didn't I read it? My dad's an attorney. Why didn't I have him look at it?
Yeah.
Like, and and now I'm like, that was a blessing. Like, and it sounds so weird, but it's like my due to my failing mental health, um, you know, my practice was not increasing in value, right? And so I can't say if it would have decreased or what it would have done, but it's one of those things that I did have the ability to kind of sell it at the height of the value when I was the purveyor of it. Um, so,
Yeah.
my advice to dentists that are struggling with mental health really is to just start talking to somebody, and if you try one thing, um, you can tell pretty quickly whether something is working or not, if it's moving the needle. And if it's not, then maybe try somebody else. I think that overall, the climate for discussing mental health is something that's better than it's been ever in the past. So it's pretty uncommon within your group of friends and family if somebody else has not had something and had some success with a certain modality. And so I would just say to just start the conversation. Don't be afraid of being judged or different things like that. Really just start taking some steps in one direction or another and course correct. My journey was a lot longer than it needed to be, and that's something that is unfortunate for myself, but probably more so for my wife. And
Kids.
think
Oh, you've got
kids,
5 kids,
yeah,
right?
yeah, yeah. And the kids are not, they know what's going on. They're
Yeah.
sharp. They
Yeah.
they think that. So um But as far as discussing my wife, and you said, to give maybe a little update on Slate, one of the hugest blessings was that um, my wife is an entrepreneur. She's owned several businesses in her life and been very successful at it. And so she decided to step in and take over Slate pretty quickly after I had my, initial breakdown. And so as far as Slate goes today, I'm quite hands off. We're developing several new products, so I'm obviously very involved in that side of it. But she's now got a small team of people, and we're actually moving out of our house for the first time. So we have a pretty big garage, our basement. We on any given day we'd have like 5 to 8 people working out of our house. So we found this cool old firehouse downtown in Spokane that's going to be our home for the next probably 4 or 5 years, if not more. But anyway, so yeah, for those of you who aren't aware of Slate, Slate really is, in my opinion, something that really helps our patients deal with their anxieties, right? So it's a handled flosser, roughly the same shape and size as a electric toothbrush, but on the end it has interchangeable heads. We have one for kids in braces, one for people who don't have braces. And then it has 3 different settings in it that have vibration that helps the floss pass through all your tight contacts. And then the secret sauce for our product is on either side of the floss strand. There's these little triangularly shaped gum sweeps. And so instead of creating the C shape, like we've always taught our patients to do with the string floss, that embrasure shape is built in. So you just simply pull it out toward your cheek and in toward your tongue, reaches into the space, massages your gums at the perfect angle, while also pulling out the food, plaque, and bacteria that could be causing cavities. So really very quick, very easy. Also has a tongue scraper on the backside. So we're really addressing every critical area of the mouth that your toothbrush misses. And so as far as the anxiety goes, when I invented the product, I was really quite confident that people would floss more and that they would floss better. But the unintended consequence that has been even more probably fulfilling for me is just the fact that this product is changing patients' attitudes towards the dentist, right? I would say most middle-class Americans usually brush their teeth once, if not twice a day, and they do a decent job of it. But floss every now and again, right? You have something stuck in your teeth, or it's just like, I haven't done it for a week, so I might as well do a little bit of it. So when those patients come into my practice, there really is this kind of ambiguity of like, if the dentist tells me I have 0 cavities or 3 cavities, I won't be surprised either way, right? Because I haven't been flossing. And so with this, people really are coming into the practice with a lot more confidence and just being like, hey, I've been doing exactly what I need to do. And then if they do say have a small little cavity, I found that those patients are now much more a partner with me in their oral health than they had been previously, where it's like, wait, I've been doing it every week. Do you see anything where I could do it a little bit better? Or was this just something that had started previously and was almost inevitable? So really that has been so fulfilling for me to have these patients that have just had a very tenuous relationship with the dentist their whole life are now like taking control of their oral health.
Yeah, it's so cool to hear like this, like you mentioned that you like woodworking and kind of this like creative engineer brain come and like really focus on a problem that needed to be solved within dentistry. Also, I'll just mention to those listening, we'll throw the website to Slate in the show notes. So slateflosser.com. That's really cool to like hear about what it does. I actually hadn't ever like heard you talk through like why it's so good. So I'm gonna go get one myself. That's freaking
I'll send you one.
which also, so the listeners know, when he talks about like his hygienists and like what the work they're doing, the whole practice that Dr. Danny's working out with a few other dentists is one of the best performing practices in the whole country. So like I should have probably introed with this, but like top 10% at patient retention. So the patients clearly like coming to their practice, that like clinicians, like the treatment that they're receiving, like what's happening in hygiene. One thing, since he brings up hygiene and flossing, their hygiene department is probably in the top 1-2% of performance when it comes to production. Like they are a really high performing hygiene team. And I'm sure a lot has to do with the fact that they are like leveling up the care that the patients are receiving, right? Like making sure that they're doing things right, feel comfortable, like you mentioned, being like a partner in their care. So
Yeah.
as you listen to Dr. Danny talk through, like, hey, here's kind of what we do in the practice, like, don't listen with ears that are like, oh, okay, cool, that's a cute thing. Like, it's coming from a dentist who's working in a very high performing practice that has found out a lot of how to like really take care of patients and clearly enjoy what he's doing too. So
Yeah. And one last thing is that in our practice, several other practices here in Spokane, um, we sell sleeves that go over the flosser. And a lot of my hygienists will floss their patients' teeth at the end of the appointment using the Slate electric flosser. And then it
nice.
becomes a really important education tool, because you floss patients' teeth, and they're like, wait, what did you just use on my mouth?
Yeah, what
Like,
is that
and
magical
then
thing?
right, and then it really creates this loop. So for any hygienists that are listening, you can actually go to the professionals tab on our website and sign up to get yourself a discount code that gives your patient 10% off and also gives you as the hygienist the 10% kickback of the sale. And so for hygienists that use it in the practice, the patients are like, that feels amazing, I want that. Then they sell them the flosser, they get a little kickback, and then in 6 months, your work as a hygienist is significantly easier because
Yeah.
the majority of your appointment as a hygienist is spent in the embrasure, right? And so we're tackling that. And so my patients that do that, my hygienists are like, 20, 30 minutes into the appointment, I'm like, I really have nothing else to do. Like, so it really kind of then scratches your own back. And then if they come in, they're like, have you been using it? Yep, I love it. Do you have any friends and family? Here's my coupon code. And so it just kind of revolves. It's great.
Yeah, I love that. Now, Danny, we've got to wrap up. I
Yeah.
ask every guest the same question to end, and it is, what does growth in dentistry mean to you? So I'd love to hear your answer to that. And then we'll wrap things up for the day.
So for me, growth in dentistry is something that, like I said previously, it wasn't my plan, but I am so much happier working in a practice that knows how to utilize tools like dental intel and things like that, so that I get to show up and we use the huddle, we use all the different things and maximize my day to the point that I just love coming in. It's profitable for me to come in. I get to treat patients well. And so if you're maybe not happy being an owner, there's a number of practices like my own that are kind of smaller group practices that have really learned to use these tools effectively. And that personally has really helped me to grow.
Yeah, I love that. I love that perspective because yeah, owner really isn't meant for everyone. I think that does get pitched pretty hard. Like when you're getting into dentistry, it's like, oh, that's the only way to like really do well. But you've obviously proven otherwise. So, well, thank you, Danny, for
Thank
jumping on. We could
you.
talk for hours. It's been great to meet you. And once again, for those listening, thank you for joining. This has been another episode of the Growth in Dentistry podcast. My name's Steve Jensen, your host and fellow data nerd. Keep growing.